Hey Camp followers, this is day 2 of me having this amazing opportunity to speak to Siobhan Menzies. Please say a little bit about yourself so people can update themselves. You are?
Okay, so I'm Siobhan. I'm from Northern Ireland, owner of Holistic Pet. We run pain clinics in 6 practices in Northern Ireland. I'm quite old. I've been a vet for almost 30 years and in rehab for 17. And I'm also a veterinary consultant to the UK Cannabis Clinic. So passionate about pain management and rehab.
If I have your passion in another 10 years, I'm going to be so happy with myself because
you're going to be so tired.
Well, the thing is, I think I've been on my journey. God, it's near, probably about five years. Where it all just started going bing, 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 bing. If I'm still like this, wow, yes. Anyway, back to the point. We're talking about CBD. It's massive. It's trending. It's a huge market. What was the latest figures of believed sales?
Oh, 300 million in the
UK alone. 300 million. And it's a topic that comes up in Holly's Army, our community group, all the time. And it's one that we feel very, very restricted in how we can advise. We always feel like the party pooper. That's the truth.
Yeah.
If somebody says something about CBD, I end up, wading in and just saying, well, this is how we are. This is this is the truth. And we just seem to be the negative ones. So today's episode, we're going to talk about research that is currently available, what it means, because I know that I was born with the gullible gene and I'm quite grateful about it now. So I read a paper and I go, oh my God, this is amazing. And then someone will read it and go, no, Hannah, there's no strength of evidence there at all. So I have to have people like the lovely Siobhan kind of break it down for me. So I'm allowing you to join in my conversation with Siobhan. So tell us what we currently know and we're quite strong with our knowledge base about.
Okay, so the research is really complicated. Okay, the human studies are promising, but we've got to be very careful that we're not comparing apples with pears. Okay. So some studies will use THC, some will use THC and CBD, others use pure CBD. So really we need to be sure that what we're looking at in a study is what we think we are. So if we're studying CBD, is the study using CBD or a mixture of THC and CBD?
Yeah.
So in the UK at the moment, the medicinal cannabis products that are available on prescription are Epidyolex, which is pure CBD. And that has just received nice approval for 2 rare forms of childhood epilepsy.
Right.
In the UK.
Just to put in, and that is completely financially prohibitive for any vet to be able to prescribe. I read somewhere that we just couldn't.
It is. I think it's like it's 20 grand a year, but I'm not sure about that. But it is really, really expensive.
Yeah, exactly. So that's why your vet doesn't go, oh, I'm just going to write you a prescription for Epidyolex because no, it's not going to happen.
And there might also be an issue, I'm not sure, but there might also be an issue where Epidyolex should be preserved for those children.
Yes. Cool. And moving on, yes.
So we've got Sativex, which is a mixture of THC and CBD, which is an oral mucosal spray licensed for muscle spasticity and MS sufferers.
Yeah.
And we have Nabalone, which is a synthetic THC product, and that is used for nausea induced by chemotherapy.
Right.
Okay.
So they're pretty hardcore reasons, aren't they?
Those are pretty hardcore reasons. But the best evidence suggests that in people, it's not addictive. Yeah. Okay. Well tolerated. And there's no serious.
CBD or CBD and THC or?
No, CBD. CBD alone. We always have to talk about CBD alone in the UK. So those studies are worldwide where they're studying THC. Here in the UK, it's CBD that is legal.
CBD.
So the best evidence suggests that it's well tolerated, it's not addictive, and there's no serious adverse risks for sustained use. Okay. In addition, there may be further medicinal benefits which have yet to be scientifically proven beyond the 2 forms of childhood epilepsy.
Right.
Okay. But really what researchers need to be doing now is using standardized forms of pure CBD so that if they say they contain 250 milligrams of CBD, they contain 250 milligrams of CBD, not 249, not 251. And then we can start to compare the different papers and the different dosages used and the different conditions that they are researching.
And that's important. So CAM followers understand this, that when you read a paper, it might have 10 dogs, 300 dogs, 3,000 dogs. Now, we will get more information in big study groups. Yeah, so a study looking at 4 individuals is really not very strong. We want to be looking at studies that can bring together 4,000 individuals so that we can look at all the possible adverse events and all the possible benefits and how long it's really likely to take to work and how long it will last. The problem is most study sizes are quite small. So what they then try to do is go, well, that group did a study with 30 dogs and that group did a study with 100 dogs and that group did it 200 dogs. Let's bring it together. But everybody's using different products. So you can't actually go, oh, I'm just going to put it on, because they're actually different studies. So back to the point, yes.
So, I mean, there's masses of studies taking place all over the world. And I think 1 in 10 are taking place in the UK on CBD.
Wow.
Yeah, and so they're studying areas like anxiety, sleep disorders, pain, chronic pain, fibromyalgia, cancer, epilepsy, you know, all immune-mediated diseases such as diabetes. So these are the areas that are being studied, but we have no definitive proof yet. Okay, the studies are ongoing. So this is at a very exciting stage, at a very early stage, and we look forward to see what can be proven.
Yes.
Now, from the animal point of view, the research in animal, there's a large amount of research done on experimental situations with animals, but there's only a very small number of good clinical studies. And as you say, Hannah, these studies are very small. Generally, veterinary studies are quite small with a small number of individuals.
Yeah.
But there was quite a good study by Cornell University, which studied osteoarthritis in dogs.
Yeah.
And so the dogs were given CBD or placebo. And this study showed that the dogs with CBD had a reduction in their pain and an improvement in mobility compared with the dogs given placebo. So it showed
only
16. Tiny number. Tiny number. Yeah. So it's safe and effective in the short term, or that study showed that it was safe and effective in the short term for treating OA, but that's not enough to claim a medicinal benefit. Okay, much larger studies and much longer studies are needed. And those studies are ongoing. There was also a small study on epilepsy, which was promising. And again, they're doing bigger studies. So this will be an exciting time. We'll learn an awful lot more.
And what can followers need to know that when you cross-compare that to what a non-steroidal will have to go through to get to market, we're talking a different kettle of fish, and we're talking, you know, clinical trials that remain kind of locked away in private for 3 to 5 years, and then they come out into the public field and they're still being trialed and they're still collecting more data, and products can be removed after being released because data on the bigger, wider circuit shows that yes, it is contraindicated in that, yes, it shouldn't be used in that, oh my god, there was a reaction over there, we need to think whether this should be publicly available. So when you have drugs coming out to market, they take a lot of work to get that confidence behind them. And we're still very, very early on our journey with CBD. It's exciting. We're not poo-pooing it. We sound like the fun police the whole time, but it is early days. And go back to what I said in the last episode, if your vet seems disinterested, underconfident, not persuadable that CBD is a good addition to your management plan, it's because they're thinking of your best interest, which is we still need to know more. Your dog is already on 3 medications. I'm unsure what this is going to do by adding it in the mix. It could be brilliant. It could be a disaster. So be kind to your vet because there is still so much to know. Anything else we need to know about research?
And well, that's pretty much where we are at the moment. The studies are ongoing. We look forward to seeing what the results will be. But at the moment, we can't claim medicinal benefits. So there's 2 aspects to it. I think that one is the quality of the human food products out there. And the other is the early stage in the research. But we understand the mechanism of CBD. We understand what we think it might do in the individual. And it's just using that knowledge safely in our animal population. And
Yeah.
that comes down to the next bit of our conversation about the VMD statement on cannabinoids.
Yeah, absolutely. And I think what we'll find, like, so there's been a new drug launched as a comparative. So there's a new drug out from Elanco and Galliprant, and they will be very quick to say, well, we haven't used it in dogs with liver disease. No, we haven't used it in dogs with kidney disease. So we can't answer your questions yet. You know, we're still collecting data, but what we do know, and the same applies to CBD, is that it hasn't been used in a huge population with all that are already suffering different ailments, you know. So this is what we worry about, is if I've got a dog that's got kidney disease, it's got a liver complaint, it's been having some partial seizures, and it's got severe osteoarthritis, I don't know. Fair to say?
Oh, very fair, yeah. And I think, you know, because CBD is metabolized through the cytochrome P450 system, we have to be very conscious about drug interactions as well, potential drug interactions. So other drugs that are metabolized by the same system might actually be got out of the system quicker or retained in the system for longer if given with CBD. Okay, yeah. And so, you know, the UK Cannabis Clinic has produced a booklet of potential interactions, which it makes available to all of its veterinary members. That's so useful, because you can then look at the medications your dogs are on and say, well, they're on some antiarrhythmic drugs, so I'm not going to use CBD for that because that's contraindicated. You know, and you can judge the risk, you know, involved in using CBD along with other medications. And, you know, these are things that, you know, because people are saying, oh, it's safe and it's natural, you know, there's lots of natural poisons out there, you know, and we have to be very, very conscious of the potential of doing harm to our patients.
And I've got a story like that. So my dad, you know, he's 78. Don't shoot me, Dad, if I got that wrong. And he's got lots and lots of bits and bobs going on. And, you know, I looked into buying him CBD. This was about 2 years ago. And I was like, oh, you know, he's talking about it. You know, maybe I should help my dad out. And I just went, no way, Dad, you're on about meds. I just could not do that to you. I don't know what's going to happen if I add this to the mix. Cool, so we're going to be back tomorrow, and we're going to start talking about the Veterinary Medicines Directive and what their viewpoint is on it, and therefore why us small animal vets may come across as quite black and white. We're going to see you tomorrow. Bye!